So we'll go ahead and start that recording process now. Yeah. And let me say good morning. Welcome to the safety work group for Envision Athens. And I think we all only have mostly people who have been here before, with one exciting new addition. So Chief, I'm going to start with you. If you can introduce yourself and our guest and newest member, and then we'll popcorn around and do quick introductions and then dive into the agenda. Good morning, Chief.
Good morning, Mark Pulliam with Probation Services. And with joining me this morning is Cassandra Bailey. It's going to be our new counselor for the Phoenix project. We're excited to have her. She just got started last week, so we're getting this kicked off and she's hit the ground running. Yeah.
Hi everyone, my name is Cassandra. I'm the new counselor. Spoke with Erin yesterday about a few of the visions that we have going forward, especially with Dale in mind, and I'm excited to get started.
Welcome, Conchandrea. And let me say that was a very dramatic introduction with the placement and I really enjoyed that. Yeah. So John and I met with Conchandrea yesterday, and y'all, she is ready to go. And so very excited to have you with us, Conchandrea. Next, John.
Hey everybody, John Morris, project coordinator at Envision Athens.
Deborah.
Sorry, I was taking down everybody's name. I'm Deborah Gonzalez. I'm the District Attorney of the Western Judicial Circuit. Happy to be here, and good morning, everyone.
Welcome. Will.
Hi, I'm Will Fleener, with the Chief Assistant with the Solicitor's Office.
Good to see you, Will. Laura.
Hey, I'm Laura Alexander with Advantage Behavioral Health Systems.
Judge Sweat.
Good morning, I'm David Sweat. I'm a senior judge and working to support some of the projects that Envision Athens and the court's working on.
Elisa.
Good morning, I'm Elisa Zarate. I'm the court administrator for the Athens Clarke County Courts.
Robbie.
Hey, I'm Robbie Cochran. I'm with the Athens Clarke County Police Department.
Katie.
Hi, I'm Katie McFarland, Director of Justice Programs at Advantage Behavioral Health.
Pryor.
Pryor Green, I'm an evidence-based practice manager for community corrections in Virginia. It's a long story, and I'm doing some projects helping Deborah with the pretrial program. So looking forward to meeting with Will today.
Larney. Larney may be here, but not quite here this very second. Larney is a person in recovery. She works very dynamically with Acceptance Recovery Center. And she also has lived experience with probation. And so her perspective is really important to the conversation, and glad she could join us this morning. So guys, let's dive right in. As you all well know, the reason that this group gathers specifically is to increase the person-centered nature of probation. Specifically, we articulate that by saying develop a comprehensive community supervision plan to provide optimum opportunity and effective accountability for people involved in the criminal justice system. So I'm very glad you guys joined us this morning, and we've already welcomed Cassandra and celebrate her new role as the counselor with probation. Chief Pulliam, so glad that you're with us, and we've really enjoyed our offline conversations with you, John and I, as we've kind of shared the history of this group, and I'm really eager to support your leadership and embrace your vision for the department. So would love to hear any updates you have, especially connected to the success measures for this group.
Well, as we've spoken recently about the success measures and what's being done currently, the counselor role being filled is going to move us drastically forward in where we were at. I think we're doing number one, the meeting and doing the roundtable, training the supervisions, community supervision personnel. For the most part, has been done. Now, looking at the OST and the MOST that John sent me just a couple of days ago, I think there will be some additional training based on some of that. We've got Consundria working as a counselor to collaborate and promote the continuum of care. I think that's going to move forward relatively quickly. Trauma-informed care, we've discussed needing to get some more training for that. Identifying the service gaps, I think Consundria is going to help us a lot there. Expert, we discussed last week, the officers have been trained in it. I think we're going to have to go back and do, after Consundria came on board, she went and met with the officers, and while they've had the training, it's been so long ago, a lot of them have not been using it. And so there'll be some refresher training in that to get that started and get it up and running good. So I mean, I think we're doing well. We're steadily working on the list, and I think that you'll see that continue as we move forward.
Absolutely. And Chief, one of the things we discussed that I think is part of this movement toward person-centered probation is the increase in access to required testing. Can you share a little bit more about what your office has done recently to accommodate that?
We've opened up and expanded the drug lab hours. If you're saying testing, I'm assuming, is that what you're referring to?
Yes, thanks.
When I arrived, they had done weekend testing in the past. Due to COVID, they had closed it down and they had shrunk the hours during the week down, and had everything set on a 15-minute time slots to keep from overloading and having a bunch in the waiting area. Since then, kind of relaxed things. We've gotten the weekend drug testing back up and running. So now we're doing drug testing on the weekend between 9 a.m. and 2 p.m. So 5 hours either on a Saturday or a Sunday. We've also expanded the hours during the day from 8 a.m. to 6 p.m. And that seems to be working well. We haven't noticed a lot of people gathering in the lobby. I think the most we've had right now is 2 to 3 at a time, waiting to be tested. And we've got enough space out in that lobby to accommodate that and still keep the social distancing. So seems to be going really well.
Mm-hmm. That's great. That's great. And I know when we met, it sounds like you received really positive feedback about those additional hours really helping people balance their work lives. And I think that's a theme everybody's familiar with that is, when requirements undermine a person's ability to participate in the workforce, that's clearly an example of making it really difficult for people to do the thing that we want them to do. So I think that's a really key accommodation, Chief, and really helpful. Early on, we talked a little bit about outreach and even the idea of home visits or something like that. Now I know that has a lot associated with it right now, still being in a pandemic, but will you say any more about that? And if you think that or a version of it might be upcoming?
There will definitely be more of that upcoming, not necessarily for every probationer, but for the ones that we're having that are struggling the most, the ones that are missing appointments, the ones that are having a hard time meeting their requirements of probation. We're working now. In fact, we've worked with the courts here recently to get some additional radios. We can get officers back out into the street and doing home visits and trying to meet them where they're at. The other thing that we've done is we've started, Judge Auslander mentioned maybe trying to pick up some of the ones from the accountability court that had kind of gotten off the rails, to where we could get them picked up a little quicker, back into the courts a little quicker, and try to get them back on track. I know that initially he sent us a list of 5 names. So far, we've been able to locate 3 of them. 2 of them we're still currently working on, but there's a lot going. There's a lot moving and changing. So
Yeah, absolutely. Larney, good to see you.
Good morning. Sorry, I was on the phone with probation. Sorry.
That's very special. I did introduce you. I think I did an adequate job, Larney. You can go back and watch the recording, and if I got anything wrong, you can, send me an update.
Thank you.
Chaplain, are you there? Would love to welcome you if you're available.
Hey there, good morning. Yeah, I'm here just running around in the background. Sorry.
Oh no, good. We just wanted to acknowledge you. Thank you for joining us this morning.
Absolutely. Great. Thank you for the invite.
Absolutely. All right. So let's open up then the work plan. Are you all able to see this list adequately? Okay. So just looking through the success measures that we've been pursuing together, the ones that stand out as really key opportunities to move forward at a greater pace now that Conchandria has joined as the counselor with probation definitely include number 3 and 4, 5, and then we had a good bit of discussion about 9 and 10 yesterday as well. So we'll get back to that in a moment. But before doing that, I just want to open up the floor to anyone who has an update related to maybe some of these other success measures, and then we can talk about how this group might move forward. So let me stop sharing for just a minute. Will, I'm guessing you have an update related to the diversion program.
I do. I didn't join the meeting today just for that, but we do have somewhat of an update on the pre-arrest diversion, and I'm sure some of you know because I think I've talked to some of you about this. But we waited for a long time to get our first pre-arrest diversion cases. We did get a few cases last month. The interesting thing is how different they are. There were a few cases where the individuals were young, had limited or no criminal history. And seemingly that's the group that when we first thought of this program, that's what we were targeting. But we also got an individual referred to us in the pre-arrest diversion program who's been arrested, I think 45 times. I think he's probably in his late 60s, early 70s. But we're having some success with him, and it really it made clear to us that this program could be really helpful for sort of wherever someone lies on the spectrum in terms of their relationship with the criminal justice system, how many times they've had an interaction with law enforcement, that there still are benefits, even for somebody who's been arrested over 40 times and is later in life. And it was really it's been really eye-opening. He obviously has a lot of struggles, and he's homeless, but we have been working with him. He has been working with a number of other organizations in town as well, and he's got a long way to go. He has no identification, and he doesn't have a birth certificate, and he was born in another state, so he has difficulty getting that birth certificate. So you can see where alone a lot of those problems were almost insurmountable for him in terms of ever really being able to get himself out of the situation. And he does really genuinely want to improve his situation and doesn't want to continue to have interactions with law enforcement. And most of his interactions with us, with law enforcement, have been really minor. It's criminal trespass being places where he's barred from, but mostly he's just needs a place to rest most of the time. He's not really causing a disturbance most of the time. He just really can't go hardly anywhere on sort of the northeast side of town. He's barred from almost every business there. So anyhow, it's been interesting. We still don't have as many cases as we would like. We're still trying to work on that from that end to try and get more cases referred into pre-arrest diversion. We appreciate probation's help with that. Jay Johnson has been working really closely with the case I'm talking about and probation. And but yeah, it's still slow going, but it is positive that we at least have some cases. I think the pandemic really slowed. We were right at the cusp of getting that program started right as the pandemic arrived. And I think it really slowed down all of that. I think it could have been a useful program during the pandemic had we already had it underway and had been referring cases already, because it could have kept people out of the courthouse, which we were trying to do anyway during the pandemic, to avoid having crowds, to avoid having people in close contact, avoid having people together in one place. But unfortunately, we never really got any cases during that period, but we have gotten our first few cases. So it's encouraging.
Well, and a lot of what you described really illustrates those person-centered principles, right? This person who has these cumulative arrests, but many of them are probably things that could maybe not easily, but definitely be addressed with some social supports. And so just as a refresher, and maybe not everyone on the call today is very familiar with pre-arrest diversion, would you mind to just briefly describe what the program is and its objective?
Sure. So we have, in this office, in the solicitor's office, and many other offices in the state, have had what's called a pretrial diversion program for many years. That program basically, if someone is arrested, charged with a misdemeanor offense, it's referred to our office. Depending on the type of charge, we can refer that charge to a pretrial diversion, meaning the person agrees to do certain things, maybe community service hours, maybe a class, maybe a substance abuse evaluation and recommended treatment. It just really depends on the specific facts in the case. But if they complete all of those requirements, then the case is dismissed and the record of their arrest is restricted or expunged. And that program has been, in effect for many years now. But a few years ago, my boss, the solicitor, CR, got the idea that we should sort of move that process back one step, so that not only do we prevent someone from having a criminal conviction, but we could even prevent someone from having the record of the arrest. And the reason for that was a lot of employers will ask if someone's ever been arrested. And even if you've completed a pretrial diversion program and you completed successfully and your case was dismissed and your record was restricted, you still had to answer that question that, yes, you've been arrested. And some employers are savvy enough now, they specifically ask, have you ever completed a pretrial diversion program and had your record restricted? And so they are aware that these programs are out there, and they're trying to sort of circumnavigate the process and say, well, hey, we know you may have done all of that. Tell us about it anyway. And so what we sort of talked about doing was, okay, the officer could at the stage where they're about to place a person in custody, they're about to arrest the person, they could refer them to this program. And there are some other jurisdictions in the country that are doing it. They are all different from what we're doing. We've incorporated some of the ideas. Atlanta is doing something somewhat similar. Their program is a bit different. They have a very targeted group, and they have a grant. I think it's a multi-million-dollar grant to target a very specific group. There's a county in Florida that is also doing it. Theirs is a little broader. It's run by the sheriff there, who is, it's like if you had incorporated our sheriff and police department into one agency. That's the sheriff there. And they sort of run the jail, but they also are out making arrests. And so that they have developed a pre-arrest diversion program. So we looked at both those programs and their models and came up with a community approach. We came up with our own sort of model here to say, okay, this is not a violent offense. This person is not a danger. Do we need to have an arrest on their record, or could we resolve this and potentially steer them away from interaction with law enforcement without arresting them? That was the idea, at least. We've seen a lot of opportunity for that because we get these cases and we think, this is clearly a case that needs to be diverted. could the person have been diverted right then and there at the time? One of the cases we were looking at in particular is misdemeanor marijuana arrest, but right at the same time that we were trying to incorporate pre-arrest diversion for misdemeanor marijuana cases, the state legislature changed the law. They passed the Farm Bill, and that inadvertently made it nearly impossible for us to prosecute misdemeanor marijuana cases. So in effect, they have not legalized misdemeanor marijuana, but they've made it unprosecutable. So it's not a case that people are being arrested for anyway anymore, but it would have been a case that we would have wanted to incorporate into pre-arrest diversion to say, this person doesn't need to be put in handcuffs. They're not harming anyone. They're not dangerous to anyone. And we could potentially resolve this without them being arrested. And that's the kind of case that we were talking about. There are plenty of others as well. That's just one example, but that was one of the types of cases that we were thinking about, that CR was thinking about when he started mulling around this idea.
So, Will, is it, and I'll open and invite any other questions in just a second. I think it's probably pretty clear that the critical partner for this program, in order for it to be effective, is law enforcement officers. So is it accurate to say that officers are aware of this program and they know how to enact it and who to call and how to execute it?
Well, I don't know. Robbie's here on the call, so I might let Robbie answer that question. But we did offer to do the training. They did. That was declined. The department decided to do the training in-house with just their own, I think, their own officers training the other officers. We've provided there's a referral form that we want them to use that they would then we pass on to probation, so that when the person shows up at the probation office to start the program, probation already knows that they're coming and has all of their information. And we've kind of given probation this heads up to say, hey, this person is coming in on this date. And there's a whole, I don't want to go into all the details, the whole system for how we get someone referred there. And probation has agreed to monitor and make sure someone actually follows through with it without actually charging any sort of supervision fee, without charging any participation fee. And that was a big part of making the program work, because we didn't want to make it this heavy cost burden, particularly for someone like the gentleman I was talking about earlier. There's no opportunity. He's never going to be able to pay even $10 to participate in the program. So why would we have a program that excludes him? So as far as whether or not the law enforcement officers are aware of it, they should be. They've had the training, we're told. So I'm not sure if it's just a situation where it's another piece of paperwork, or if it's just so new that people aren't really sure when and where to use it. I'm not sure, but maybe Robbie could give us a little information on that.
I think that's what it is, Will. I think it's just such a new program. Officers are just getting used to it. Captain Epps did go around to all the patrol officers and had about an hour training for them, explained what it was, how we're going to use it. But yeah, I think it's just because it's so new is why we're not using it a whole bunch. They're still getting used to it.
Yeah, and the idea is a little, and maybe Mark's a former ACC PD officer. He might be able to illuminate us a little on this, but the idea, I think, particularly maybe for some of the officers who've been around for a while, it does seem sort of like catch and release. They're out there, they're policing, they run into someone who's violating the law, and they give them a piece of paper and send them on their way. And that doesn't seem appropriate under the circumstances. And I know of a number of other prosecutors that we've spoken to about this who also think it's a bad idea. So it's not, I'm not saying that everyone should automatically think this is great because we've come up with this thing. I know that there are some people who are somewhat skeptical about it, but we're not talking about, someone who just robbed a bank. We're talking about people who are charged with offenses that generally they're going to be released without having to post any sort of, cash bond or bail bond or anything like that. It's just a matter of taking them to the jail and having them fingerprinted. And I'm not sure how that process specifically in those specific instances makes the community that much safer. I open to listening and seeing, why that might be. And I'm sure there are certain instances where, for instance, in a criminal trespass case where someone just won't leave, the police officer can't just write them a ticket and give them a piece of paper and leave the situation. They haven't solved the problem. If someone won't leave and they're being told to leave and they're refusing, that's criminal trespass, but the officer really doesn't have any choice but to physically make the person leave. And there are unfortunate circumstances like that, and I can think of others too, but I can also think a lot of situations where even the officer probably doesn't want to have to arrest somebody. They want to resolve it in some other way. And that's what we were hoping to find, is those sort of situations.
Well, I appreciate it. And I didn't really give you a heads up that we would spend a good bit of time talking about this morning, but I know you're always prepared to talk about it. And, because of COVID, this isn't an area that we've discussed a lot in the last few months. So I really appreciate the update and the fact that we're having the opportunity to move it forward and see the program begin to work. So thank you for your work on that.
No, I'm happy to talk about it.
Any other questions for Will on this? And then I have kind of a follow-up question for Katie and Robbie that I think is connected, but don't want to cut anybody off. Okay, Katie and Robbie, I was just wondering, as Will was describing how the program works and can work, we've had some expansion and replicating of the co-responder model. Would you mind to briefly update the group on that? And then I'm wondering, because the co-responders are uniquely trained and situated to consider exceptional circumstances and respond to them, I'm wondering if there's a unique connection between pre-arrest diversion and the co-responder officers.
Sorry, I'm thinking, Robbie, do you have thoughts on that? I mean, most of what we do is diversion anyway. I mean, I can think of last week with the woman that was breaking into cars, Robbie, that immediately she was going to the hospital in lieu of, so nothing even happened. So we do a lot of that anyway. Robbie, do you have thoughts on that?
Nah, not really. I'm kind of with you. I think we're trying to catch it before it gets to that point a lot of times.
Gotcha.
Yeah, and when we first when we first sort of were developing this idea, we had also developed a separate mental health pre-arrest diversion that was going to support the teams as they're responding. And I think what we realized is, they're already really doing that. If there's some way that probation in our office can support them, and we talked with Judge Sweat about this extensively as well, how we would do that effectively without getting in the way, because they're already doing an exceptional job diverting a lot of cases where there's a mental health issue, and so we weren't trying to step on any toes. We just were saying, well, if there's something we can do, particularly if we ended up with an actual coordinator for this program who was hired to manage the cases, could that be helpful? We're not anywhere near needing a even part-time person right now to do it, but if we got to that stage, could we be helpful? And I think there's still some possibility for that right now, but I think those guys are already doing such a great job. I don't really see where they need us to help them in any way, but if that were to change, then we'd be happy to do that.
Yeah, I think later down the road, there's a few cases here and there with our frequent flyers. But a lot of times with some of those, they've been referred to TAC court, other programs and services that are a little beyond actually even PAD. But I don't know, that may be in the future, I'm thinking as you're talking about one of your cases that we probably have a few more people that might be PAD appropriate here down the road. So.
Yeah. I suspected and knew that you all were very well connected. So I wanted to ask that question so this group could kind of hear how it all works together. And then can you guys update us on how the co-responder program has expanded and what the size and scope of it is right now?
Well, currently we have 2 teams. I'm trying to hire a 3rd clinician. We had interviews, I guess, it was last week for a 3rd officer. The challenge is finding a clinician. It's a little bit like hiring a unicorn. We need somebody who has a full clinical license. So that in itself makes it difficult, because I keep having a lot of people saying, hey, let's get somebody right out of school. I've had lots of bites from people right out of school, but we need somebody with more clinical skill to make those big decisions, an independent practitioner. And so finding a fully licensed person has been the hardest. I've had a few bites. I've had some colleagues, some great social work colleagues out there pushing this, but it's also a job that I know I didn't go to school for. And a lot of clinical people, they want to sit in an office. They don't, being out with the police with screaming, half naked people is not exactly what they even know what to do with or feel comfortable with. Perception of danger, which is not there. So there's just a lot of misinformation that I'm also trying to clear up as people ask, but we're looking. So if you guys know fully licensed clinical social workers, fully licensed professional counselors, or would like the information to help us spread the word, we need the clinical staff. And so that's the biggest struggle. It's kind of been on my mind lately. And we are, going to expand more than that, but first we have to get our third team off the ground.
Yeah. Katie, will you send the posting job description for that? And we can include that as an attachment with the notes today. And then also just in an hour in the health domain, we'll be kind of diving back into the results of the community behavioral health needs assessment that just occurred in the last quarter. That was funded by Resilient Georgia, and Envision Community Foundation and AWP participated in that together. And so we have a pretty solid list of people who are a combination of clinicians and otherwise. So I can share that through that network, which is regional.
Yes.
So maybe that will get some bites of people that have some experience.
Yes. And I will tell you, we're not the only community that is struggling with this. Robbie and I have our hands in with other co-responder teams across the state. I can tell you, Clayton County's trying to hire a social worker, paying pretty well. They're not getting bites. That job's been posted since February. A couple other counties are looking, and they're not having luck either. So Georgia also has a shortage of providers as well. So that also fits in with it. So, but I appreciate it.
Question, Katie.
Yes.
I think I read that the mayor and commission are recommending an additional 4 co-responder teams. Is that correct?
Yes. Yes, which is what
to be
this is on my mind.
Could any of those just be like master's level, or do all 7 need to be fully licensed? That's
a good question. I think as we move along, I don't know, we might have to get creative. It may be if we have multiple teams working at the same time, we might be able to do something a little bit different. But again, having somebody that's really clinically strong, they may not have access to the fully licensed person if they need the help or consultation if they're out on a call, and being able to sign a 1013 when necessary is a big piece to that. So, but that is something I think that we are willing to think outside the box to a certain extent.
Katie, is it possible that we could implement some use of certified peer specialists, forensic, that could do some of the ride around and do some of the work that you were talking about?
I don't know. I mean, one of the big pieces to this is assessment and assessing of crisis and things like that. And I would want, there is a place for a peer specialist to help. We've actually had some recent situations where we actually used Laura McCoy, who's our street outreach, but she's a peer specialist and she's amazing. And she's helped with a few situations that probably our co-responders couldn't have made happen. But that was after the co-responders did their initial assessing, that she sort of swooped in and helped. So I think there is a place for peers, and I would love to have access to them as needed for different situations.
It would be amazing if we could collectively, collaboratively find ways to fund formal training for some of the peer specialists who, you know, have some of the lived experience and other things. I agree. It is all necessary, right? You can't forego the assessments, but also that peer role can really add incredible value.
Yes.
And then Judge Sweat, you and I had a conversation about the Justice Mental Health Collaborative. Did I say that name correctly? And I think that collaborative is represented here today by a few different people. Can we get a brief update from your group regarding how that's moved forward? I understand there's funding there as well for a different counselor position.
Well, and there are two things going on that, and Elisa could maybe speak to this more than I on at least part of this. The Justice Mental Health Collaboration has been, it's kind of been an informal group, but it's individuals from Advantage and law enforcement and with support from the Fanning Institute. One of the things we're working on now is a case manager position that would, we think, be what is going to be a jail in reach person, amongst other duties. I mean, and trying to define this has been something we've been working on, but at least part of it might include pre-release planning and post-release follow-up for individuals with behavioral health needs, treatment needs in jail. And I think there's several moving parts to that. One is determining how we are assessing individuals who are being detained and held, and how we can connect them to more immediately to treatment if they are engaged in treatment and become incarcerated. And then another part is planning for a release with conditions, maybe, and then having a follow-up in so that we can know that individuals are working on in treatment or on other issues that need to be addressed for them to avoid return to confinement. And this is part, so we have a funded case manager position. We've got some other money in that. One big piece of that is a data exchange system that between behavioral health and law enforcement. And so that's a piece that is getting started. We've identified a program, but there are a lot of HIPAA issues and legal issues around how that data can be exchanged. But it's being done in some other locations, and I think so. I'm optimistic we can work through that. But I think the big piece is a case manager who can be sort of at a pivotal point and connect to individuals in custody, to the courts, to treatment, and hopefully have better outcomes for individuals who may be have been frequently arrested. Now, the other piece is, and Lisa, you want to speak to the COSSUP grant and what that's going to be bringing?
Sure. So the COSSUP grant is a 3-year federal grant that we got through BJA. It's a statewide grant. CJCC helped us write that grant as a statewide initiative. Savannah was one of the other counties, and Judge Sweat and I just had our first technical assistance meeting with them earlier this week. But COSSUP is basically it's a diversion program grant. It stands for Comprehensive Opioid and Stimulants and Other Substances Site-Based Program. So it's a very new program. I know I keep saying that we're going to have to build it from the ground up, but really a lot of these initiatives are kind of already happening with the PAD program and the co-responder team. This grant includes one personnel position, which I'm finalizing with HR. I'm planning on listing that position either today or tomorrow, but it'll be a full-time position. You know, we're still kind of trying to figure out where this individual will fit in. And Judge Sweat and I have talked a lot about how, we see this position as working, collaborating with the social worker at the case manager for the Justice and Mental Health Collaborative, the counselor at probation, and just kind of working together. But it's still in the early stages. Once we get this position filled, then I think we'll be able to get all of the stakeholders together and just kind of move forward with that grant. But this grant does have an educational piece for juveniles as well. So Judge Trimble was very involved with writing this grant, and that'll be I guess the main piece that we're not quite sure how I guess that's going to work, because it's education coming from a law enforcement perspective. And I know Will, on with PAD, you had kind of approached me and Kristen about helping with some of the referrals for PAD. So we actually thought that this position might be able to help with your program and those referrals. So it's, like I said, still in the early stages. We're still trying to kind of work through it and see how this position is going to complement some of the other positions. But it was a great opportunity that we're just very lucky and glad that we have. And it now seems like a good time to sort of implement this.
It's another Dale Allen legacy that he created and submitted this a year or so ago, and we, was granted and awarded. The position that we're calling it Criminal Justice Diversion Coordinator, and hopefully that person is going to be reaching into a lot of different areas in the courts and with law enforcement and with treatment to try and coordinate assignment to court programs as appropriate, or connection to treatment as appropriate. There is some treatment money and housing money in that, not huge amounts.
So we've moved just within the last 12 to 18 months from, I think, almost a complete lack of social work, case management, counselor provision, to now moving into the space where we're hearing, every update relates to a position, which is fantastic news. I think our opportunity moving forward is to just help ensure that we communicate and maybe create space for those people to convene and share information and best practices. So if this group can support that, let us know. Related to education, I wanted to note that educating youth aging out of juvenile services is one of the success measures in the health domain. And I don't know if you've connected yet with Dr. Jillian Watley. She is the new person at the district that oversees all of school psychology and counseling and social work. So that might be a good connection to make in terms of education and social emotional learning, and how all of that is conveyed through the public school system here in Clark County.
Tell me her name again, Erin. I definitely see this position as working directly with the
Jillian Watley. And Elisa, if you will follow up via email with me, I'll go ahead and introduce you.
Okay, we'll do.
Related to the in-house case management position, will that person be an employee of Armor Correctional or another organization?
It will be an Advantage employee, so they'll be housed at an Advantage, and we're not clear about that. And the job description's been around, and I don't know. I've sent an email just to see whether it's gone to HR at Advantage or not, but it would be an Advantage employee, and coordinated probably with Katie and all the.
I'll be supervising them because of the close connection with all the other justice programs and things like that. So
I thought that would be the answer, Judge Sweat, but I asked the question just because I anticipate it from the community. That has been, a question in the past. Is this person an in-house employee of a private company, or is it something connected to Advantage or another human services provider? So that's a huge momentum here. It's very exciting. Okay, I'm just going to pause. We only have about 10 minutes left and a good bit more to discuss, but I don't want to rush through if anyone has any other updates or questions before we go back into the work plan and talk about what's next. That's a pregnant pause, guys. I'm just giving you every opportunity. It's awkward. I don't mind.
I forgot, I realized what we were talking about.
Yeah, go.
I forgot with pre-arrest diversion, we did do one other thing this year.
Yeah.
With the new sheriff, we reached out to John and asked if they would be willing to work with us on PAD. The previous sheriff's office, when we reached out to them, they said they had no authority to do that. But in Florida, in the county where they do it, the sheriff, if someone's being booked in by some other law enforcement agency, because there are local, smaller police departments there that can take someone to the jail, if they realize that person is PAD eligible, pre-arrest diversion eligible, they'll screen them away during the booking process. And so the person gets arrested in the sense they have handcuffs on, they're taken to the jail, but they still avoid the booking, which is actually really important because then it doesn't generate this criminal history as a result. So it's not the best situation. We were trying to avoid that interaction where someone's put in handcuffs, because sometimes that can lead to a more serious altercation between the officer and the individual. We were trying to avoid that, but this would still avoid someone being booked in on one of these offenses. And he did indicate that he was interested in that. He's been obviously very busy with everything that's been going on at the jail, but they did indicate they would be interested in sitting down and talking about that. We haven't made much more progress than that, but at least we're exploring that as an alternative. So
that's huge and important. And Will, that just reminded me of a question for you. In pre-arrest diversion, when someone needs social supports, who is actually helping provide some level of case management and connecting that person?
Probation would be probation is where the person would be reporting to, but we have, for instance, Ms. McCoy is working with the gentleman I was talking about earlier who was homeless. And so we've been, we have good relationships with a lot of different agencies here in town. And I don't know if it was CR or if it was, I assume it was Jay Johnson or someone in the probation office who reached out to her. I don't know. CR is the one who's working on that case, so I'm not sure the exact
Gotcha.
work, but I know that she showed up with him last week when he came, and she was there with them, and she was the one who detailed exactly what his situation was, and with his birth certificate being in Indiana, and so she's been working with him, and so we are trying to use the resources that are already out there, particularly leaning heavily on Advantage if that's what is needed. But yeah, so it's probation where things are coordinated through.
Great, thank you for that. And related to person-centered opportunity, I'm not sure if anyone on this call can answer the question, but it was noted that MAT, medicated assisted recovery or treatment, I'm sorry, was being offered in the jail historically, and the nurse and person strongly advocating for that unfortunately passed away. Can anyone confirm if MAT is still being offered in the jail? I think that's a key component of person-centered services. Okay, I'm going to follow up on that. I think that's a pretty key question for us to get an answer to. All right. Any other updates before we move back into the work plan? Okay. So one key area where we'll be having a follow-up meeting soon is noting that the item listed in number 7, SBIRT, is very effective in terms of giving the screener or person administering the screening tool insight into risk of engaging in substance use. It doesn't necessarily provide a more general sense or predictability of if this person is at risk for other things. And a couple of those tools have been mentioned today. Prior, I know you're on the call, I think still, and have a lot of experience with these tools, and were gracious enough to share those with us. So I think one upcoming conversation will be how to incorporate other screening tools in probation. so that it creates kind of a triage opportunity, ensuring that people who could benefit from more person-centered approaches are the ones receiving them, and kind of helps people determine who can be best served in which direction. Chief Kinchandra, do you care to say anything about that? I know it's very early in the conversation, but don't want to skate past you here.
It is. It's early, but we are looking, like I said, John sent us earlier this week, the MOST and the OST. And I think once we can get that digested and get it out to the officers, I think that's going to help pinpoint who needs that additional help and that additional service, instead of just trying. I don't think it's feasible to push every probationer through the counselor with Cassandra. I just don't think she would have the time. So this is going to kind of help pinpoint the ones that need that additional help the most, and try to get the most out of this program.
That's great, Chief. Thank you. And then another area of, I think that is uniquely timely right now is focusing some energy and efforts on 9 and 10 related to workforce. And I'm specifically focusing on, what we mean by second chance employment. If you guys have participated in almost any conversations about workforce realities in our region, you've probably been part of conversations about how people are desperate to hire folks. We have shortages in all sorts of areas. And I think that that really gives us the opportunity to reframe and go into conversations about more flexible hiring practices when and where possible. This coincides with the development of a jobs database. And so something that was an outgrowth of Envision's work in the education domain is working with the chamber, and they really developed this, a jobs database that has yet to include a field for second chance friendly. And I think that that's complicated a bit because second chance is an oversimplifying term, right? Like, what does that mean? And second chance for whom? So in meeting with Kinchandra yesterday, there was a lot of strong energy and interest in diving into this and maybe connecting to the chamber and starting a conversation related to a couple of things. One, can we engage to create a solid and clear inventory of employers that are second chance, and work to define what second chance means, and just kind of dive into the complexity of that, own it, and create some kind of description of second chance, and learn who our second chance employers are. And that's only part of the puzzle. I think the more critical component that can't happen without the first is to have advocacy type conversations, to work with employers who are not as second chance as they could be, move more in that direction. So that's kind of where I thought we might move next, and potentially, instead of having a larger group check-in like today, potentially have June as a small work group meeting to really dive into this question, maybe even meet in person as a small group, and potentially connect to David Bradley from the chamber on that. So just want to open it up to the group for any questions or thoughts you have. And Kinchandra, if I miss anything, please dive in.
I have one thing. As far as second chance goes, we're more than willing to share where our residents get jobs at. As y'all know, a lot of our residents are convicted felons. And so, and they're all, we have 100% employment rate. So I'm more than happy to share who our employers are, who's employing our residents. I do know for a fact though, that the one employer that gave me a chance when nobody else did was Dial America. And that's with my background. And the other one is Telenet. But I mean, it's a good stepping stone for somebody who's trying to get back into the work field. So and as long as there's no, I think it's fraud they're more than willing to give somebody a chance. Violent
Yeah.
charges are okay. Fraud is the only thing that they don't allow. So
Thank you, Larnie.
you're welcome.
Yeah, and I think what you just shared illustrated that this isn't dichotomous. It's not like a yes or no. There's kind of a continuum of folks that will hire a wide range, and then some that say this but not that, and then others that are largely completely inflexible, and maybe they have policies that are completely archaic that they're not even aware of. So I would love for us to kind of creatively explore, are there some people who we can effectively shift further on the continuum toward more openness when and where it makes sense?
Well, the other thing I'd like to share is this, from someone who started becoming incarcerated with a career. I had a career when I started being incarcerated, and I was making a lot of money working in a hospital. When I started collecting charges, no hospital would touch me. And then so I was at a loss, and I had to, figure out, what am I going to do now? No one would touch me. And I had these high hopes for myself. Like I could go back to doing what I know how to do, because I didn't know how to do anything else. And I had to swallow my pride and humble myself and start somewhere. And that's what we have to tell our residents sometimes, is we all have to start somewhere when we're trying to rebuild. And it's gut wrenching, and it's a lot of ego and pride swallowing. But it's at the same time, it's like I get to work from the ground up and appreciate what I have. And you know what I'm saying? And today I've worked really hard to get where I'm at, and I appreciate it, and I hold on to it. And a lot of these guys are successful because of that. And the women are successful because of that. So just, like reminding, it's a temporary thing. Like you might have to work at McDonald's, but it's temporary, and McDonald's has career paths, and they pay for education, like change the perspective and be like, it's not a bad thing.
Mm-hmm.
So it's just my 2 cents, but I had high hopes for myself, and nobody would touch me. Dial America did, and I'm grateful to them forever.
Mm-hmm. Larnie, thank you. I'm really proud of you, by the way. Not that you need it, but I just had to say it.
Thanks. I'm changing jobs again, by the way.
All right. Would you like to share your update with us?
Well, it's not official yet, but I'm gonna be the admissions coordinator, which is like 4 jobs rolled into one. Lead phase counselor. I'm working on a 12-month treatment plan right now. So instead of doing month-to-month treatment plans, we're gonna do from start to finish at the very, very beginning. Similar to like what DFAC's case plans are like. So I've been working on that for like the last 2 days, and it's hurt my brain, but I think it'll be better for our residents in the long run.
Yesterday, little Moses, he's our 7-year-old, came home from the Y track practice, and they had made him this plate that said "can't stop, won't stop," because he apparently had an especially good practice. And so I think that's the new hashtag for Larnie McCarver: "Can't stop, won't stop." Appreciate you.
Yeah, ARC's not getting rid of me unless it's in a body bag.
Wow. We're recording, Larnie.
I know. I've told Brandy.
Kinchandria, is there anything you want to share about our discussion yesterday, or just your thoughts about what's next? Don't want to put you on the spot, but you're invited.
9 and 10, I feel like they really work well together. I've started creating a list with DeWitt and Michael at Goodwill. They host the job fairs, and we've actually gone through and started highlighting people that don't run background checks, and then those that do give second chances to people with non-violent offenses. So I am working with him diligently on that. I did want to share that with you guys.
Fantastic. If it works for the group, I think that this particular area of emphasis and opportunity is really important. It seems timely, and I think in order to do it well, it will take considerable effort. So what I would maybe suggest to the group is that instead of meeting at the normal scheduled time in June, we find a completely different time to meet, because it backs up to Healthy Athens, which limits our time. So if it works for everyone, what we'll do in the follow-up notes, which will also include the position description for the job that Katie mentioned, is to doodle poll the group to find a time to meet in June and dive into this effort, with Conshandria kind of taking a lead to whatever extent you're comfortable doing that. Conshandria, if that works.
Yes, ma'am, that definitely works.
Thank you. And we're really excited you're here. I think I've mentioned that a few times, but I'm just going to say it again. And then Christine, thank you for being on the call today. And let me just acknowledge you. I'm sorry you had trouble kind of signing in, but Christine is with the Neighborhood Leaders Program. So good morning. Good to see you today.
Good morning, everybody. I was just typing up like a little introductory
Yeah,
message.
why don't you go ahead and share that if you're comfortable, and then we'll close
Sure.
out this morning.
Yeah, so I'm the neighborhood leader for the Whitehead Prosperity Zone, and we have been broken up into 4 groups. I am on the Safety and Community Stability and Workforce Development and Unemployment Committee. So that, and then I volunteered to be, we each kind of picked organizations, like one of the Barbara's working with the police department, and can't remember exactly the other ones, but I picked you guys as one of my organizations. So right now I'm just kind of trying to get a feel for, I recognize Judge Sweat and I recognize you, Aaron, and some other people, but if y'all don't mind putting like your titles in the chat.
Yeah, Christine, what we'll do is the notes that we'll send out, that's a great question. By the names of people, we have their organizations, and then all of our email lists stay open so that if you want to follow up with someone, you can find them and email them.
Okay, perfect.
Yeah, we try to make it easy. Thank you so much. And I've seen different examples of your work in the community, and you do really great work, and we're really glad to have you with us today.
I'm glad to be here. Thanks so much.
Awesome. Okay, so as we start to close out, anticipate the notes and a doodle poll that you will only complete if you agree to join in the work of workforce development, second chance employment, awareness, and advocacy. So any final thoughts before I turn it over to John to talk about a survey that will also be included? Okay, John, take it away.
Hey, so as we move towards, I guess, out of the pandemic and into hopefully in-person meetings again one day, we're conducting a survey right now with just all the members of our work groups. It's very short. It's just a few questions. We're looking at maybe like an early fall anticipation of return to in-person. Of course, everything that we do is going to follow whatever the public health guidelines are. But it's just a few question survey. I'm going to include it in my email with the meeting notes that goes out after, and it's going to be open until the end of May, so May 28th. I'll send a couple reminders out as that deadline gets closer. But if you can just go ahead and fill it out when it gets sent out with the meeting notes, that would be excellent. Thanks.
Thanks so much. Really appreciate this collaboration and all the good work that's represented on the call today. Have a great day, everyone. See you soon. Thanks.